So tip number 4 is align yourself with your care provider. And now that you've done tip number 1, you should be a walking book of birth knowledge. You should understand different procedures and the benefits and the risks to those. And you also should have a bit of a birth plan as such, like your birth preferences and your birth beliefs and your idea of how you want your birth to go. And now we need to align ourselves with our care providers. So we need to find somebody who makes us feel comfortable, who also makes us feel powerful in our choices, who trusts you like you trust yourself. Okay, so start asking some big questions and really gauge how you feel when you ask them, and gauge what your care provider does in those moments. Okay, our care providers are, yes, they're experts, but they're also human, and it's just like any other human interaction. If we don't feel comfortable with a certain person, we wouldn't invite them into our home, and we shouldn't be inviting them into our birth either, because that is our most vulnerable moment and we need to feel safe for our birth to unfold the way that we want it to unfold. Okay? And just because you may have already, doesn't matter when, really, how early, how late in your pregnancy, if you've had a care provider that makes you feel uncomfortable, there's never a bad time to change. Okay, if you are 39 weeks pregnant and you are feeling all sorts of nerves and you don't think your care provider is on your side, then we can always change. It's the power of choice. Choice. It's always our choice. You will find during most scenarios, especially in birth, you will find that a care provider, if they are thinking that they should be intervening at some point, and they will always ask you, they will always say, I am just about to do this, and they wait for you to say okay. So they're waiting for your consent. All right, so you always have a choice to say, oh, why are you doing that? Or do I really need that right now? Or can I have 15 minutes just to think about what is happening and gather my thoughts and make an informed decision? All right, align yourself with your care provider. Make sure you understand your power of choice and your power of consent, because you can always say no